Hi, this is Greeis. She's a doctor who works with me at the Aldo Sharia Hospital, right? And I'm going to ask her about what she remembers about COVID in 2020, right? Hi, Greeis.
Hi, Richard. So I want to tell you some things about the experience of COVID-19. So for me, it was a little bit tired experience because I work in the hospital. So I cheat frequently, but I try to.
Well, sorry, first tell me about how it was when you started hearing about COVID, right? So that would have been early in 2020 when it was, say, in China and Italy, and it was coming towards Europe. So there was nothing happening in America. So what were you thinking? Did you think it would come to South America and Nicaragua?
Yeah, I read about what happened in other countries, but I will try to focus about the situation of Nicaragua. So in the hospital, we live a little tired experience because we work hard to try to save the life of the people in Nicaragua. But I would like to tell you about the economy of Nicaragua. It was working in that size because everybody work in our country normally. So the experience was, if I compare it with the other country, was really fine because we work in the hospital, was working hard to save the people. Obviously, we feel a little bit scary about the situation because it's a new thing, on a new kind of virus that we have in that time. But we try to improve that situation, and we try to get better that situation and try to keep the healthy of that person. But obviously, like in other countries, we can protect all people. We have some death of some people, but we try the things that we can do it.
But what did you think when Nicaragua was doing different from the rest of the world? The rest of the world was locking down, and
I believe that the different it was because we working normally, so we didn't do a contingency ideas. We work normally. The business worked normally, the hospital works normally in that time. So we, in comparison with other countries, we don't stop anything in this country.
and were lots of people dying in Nicaragua because of this action?
Well, the reason of people die in Nicaragua is multifactorial, you know?
Yeah.
Because well, we have a fat people, and if we think about it, coronavirus affect in different ways, and the fat people and the skin people is the different the action of the coronavirus. Even we have people with chronic disease, so the impact was really strong for that kind of people. So obviously we don't protect all people in that way. So I believe that all affection of the coronavirus was for some risk that people have.
Yes, right. Did many of your patients die?
I can say most of them, but not everyone.
What do you mean by most of them?
Maybe 20 patients come to the hospital to diagnose coronavirus, or we think about coronavirus with this person. Probably.
And so they were very sick and they had some kind of an underlying condition.
Yeah.
Yeah, okay.
And people that we have the consider that they have coronavirus, it was visit the hospital totally complicated. So
Yeah,
he
yeah.
had a respiratory disease and distress respiratory. So he has a inflammation system, multi-organic system
Yeah,
disease.
yeah.
So it's a complication of everything.
Yeah, yeah. So the people who came to the hospital, they were very sick,
Yeah.
but everybody else, what you advised them to stay at home, or what people who had symptoms, what was
Yeah.
the advice to them?
So we said to say to them, so try to use mask, try to wash your hands, try to, if you feel something bad or symptoms like cold, headaches, fever or something like that, you can visit your health center nearly, or you can visit if you feel much or you feel bad in that way, you visit immediately in the hospital.
Yeah. Did the doctors in the hospital have protective clothing, like masks, like um, uh, whatever, gowns, plastic? Because there was a shortage of that in the United Kingdom. The doctors didn't have the equipment.
Yeah, in Nicaragua, the government, even the system of healthy, give us some equipment for protect ourselves. So they also give us some capacitation to use this kind of equipment to use in this area, because they always build an area for COVID only for that kind of people, but try to treat these conditions, so they give us capacitation of that.
And who worked in the COVID hospitals?
Obviously we have doctors, nurse, and people of pharmacy. So we do a kind of personal capacity to have prepare to attend this kind of people with COVID, no?
And who were the doctors and nurses who worked in these hospitals? Were they volunteers, or was it, were the doctors frightened of COVID or working with people who were infected?
Well, some of them was working at the hospital, but they separate for area, and then we have a schedule to rotate in these areas. And sometimes we also have volunteers to help us, but these volunteers only concentrates in the health center.
Okay. Do you know anything about the use of ivermectin?
Most of the people use ivermectin.
And that was because in America, in the UK, they said ivermectin was to give to horses and animals, right? Not to give to humans.
No, in my experience, we use a lot of treatment, like ivermectins,
Yeah.
colchicine, other one like biologic. I don't remember the name exactly, but let me remember.
And did you think they helped with the symptoms?
Well, I think that people it was like a placebo, because they getting better comfort the pathologies was getting better for the viral loss, the pathogenic. So I believe that it was the people getting better every day.
They were getting better. They would
Yeah.
have got better anyway.
Yeah.
Right? But I've heard that ivermectin can work like reduce viral load as well, but I don't know, right? I mean, some
it's
people.
controversial, because I read a meta-analysis about that ivermectin, it was very very good for the virus to try to reduce the pathogenic of the virus. But
Okay.
I compare it with the reality, and I can say that it was the effect of the virus was dying even the time.
Okay. And what did you think that, when they had the vaccine in the United Kingdom and they had the vaccine in America and you guys hadn't the vaccine? What were you thinking?
Well, I believe, or I think that the vaccine comes here to Nicaragua to reduce the pathogenic of the virus. But at the beginning, people feels a little bit scary about it because we don't know about the effects or reaction of this vaccine, so we feel scared.
Really?
Yeah.
Okay, that's interesting because in the UK and America, the politicians present it as, oh, this is going to save your life. This is going to change everything. So in Nicaragua, the doctors were skeptical.
Yeah.
All the doctors. Really? How come? Because that was very different from the medical
But I mean, my experience was really different than other side of Nicaragua because in that season I was living in Atlantic coast, so the people in that area is with thought a little bit with the farmer, so he feels like if I take a pill, probably I will be better, or they stealing her in their farm, so probably that kind of things that they do protecting in some way because always they resting at home on the farm.
Yeah.
So
well, they weren't in an urban area like the city,
Yeah.
and they were out in nature and they ate
that's
natural
true.
food, right?
Yeah. So I believe that this action was like a protector factor, no?
Yeah.
So they only came out of their farm when they feel really, really bad, or they feel with breathing disease.
Okay.
And they felt a little scary about the vaccine, but they changed their minds and they accepted to put it, but obviously they feel something scary.
Did you have the vaccine?
Yeah, I have.
Which one did you have?
Well, in Nicaragua, in that time, put three kind of vaccine, like how can I say schemas, like this is for this and this is for other.
Well, I know the people who would travel to America, they needed to have the Pfizer vaccine.
No, but the first time they put it AstraZeneca vaccine.
Oh, the AstraZeneca.
Yeah.
Oh, you had that here.
Yeah.
Okay.
And the second time they put it Sputnik.
Sputnik.
Yeah.
Okay.
And the last time they put a Pfizer.
Okay.
And the kids they put it Soberana.
What's that?
It's a COVID vaccine, but the brand is Soberana from Cuba.
From Cuba?
Yeah.
For children?
Yeah.
Okay. And have you any opinions, or do you know anything about which vaccines seem to work best, or maybe had less side effects or had more? Have you any?
Well, in my case, in my personal experience, I have bad experience with the AstraZeneca vaccine. Because,
The AstraZeneca.
Yeah, because the symptoms that or reaction that they gave is a lot of fever.
Well, it's funny because a doctor friend of mine told me because that was the first one launched in the UK. And the reason they didn't give it to doctors first was they were expecting 40% illness after the vaccine. So they gave it first to elderly people. right? So you
Yeah.
saw a lot of people having reactions to.
Yeah, the main reaction was fever.
Yeah.
With that, or in my experience, I don't have any reaction with the Pfizer. Even
Which one did sorry, which one did you say you had? You had the
AstraZeneca.
but you didn't have a reaction to it.
No, I have the three kind of vaccine.
Yeah.
So we have to put in like one this year, and then in 6 months later other vaccine.
Oh, you had different one. Okay,
Yeah.
okay.
So with the first one, the reaction was fever. Muscle pain was really, really hard. So, and then with the Sputnik, nothing.
What do you mean nothing? They did. You didn't have reactions
No,
to
I
Sputnik.
don't have any reaction with the Sputnik. And with Pfizer, any reaction too?
No,
No.
no. Okay, all right. And have you any views, or have you heard any views which people thought was better, or maybe at preventing infection or anything like that?
I hear with the other people consider that when they put it the vaccine, they started to know get infection. It's like long. Like
Okay, it's less infection because
less
they had the
infection,
vaccine.
okay, see,
Yeah. But if you think about it, then you didn't have the vaccine for almost 2 years. So everybody would have had natural immunity.
Yeah,
Anyway.
I know.
Yeah.
But they believe that it was the reaction of vaccine because it reduced the illness or the contract the illness.
Well, that's what they said.
Yeah,
but
yeah,
if you
I know.
if you think about it, when the vaccine was introduced, everybody thought it would stop infection.
Yeah, I know.
And then it didn't stop infection, so they said, "Oh, but you wouldn't have got sicker," and that's something you can't prove.
Yeah,
You know
I
what I mean? Because what's interesting about Nicaragua is most people would have been exposed to the virus during the 2 years before the vaccine, so
Yeah,
they
I
would
know.
have had some natural immunity, which was going to give them some protection, right?
Yeah.
You know. So, looking back, is there anything you think Nicaragua could have done differently during COVID?
I don't think so.
No.
So I think in Nicaragua did the thing that we can do in that time. No?
Okay, so the reports which I read in the British newspaper that the government was allowing people to die on the street and burying them in secret, this wasn't true.
It doesn't true. I don't see any
Yeah, no,
dead people in the street. I didn't see it. It's
yeah,
not my.
yeah,
It's my.
yeah, yeah.
It's
Well-
not I didn't see my experience.
Well, I've asked everybody in the times that I've been here, right? And the only people who seem to are aware of that live in Miami, right? You know, nobody seems to be. Okay, thank you very much.
Thank you so
That was
much.
good.